Okay, well, I'd just like to welcome you back, David, from having chatted through your slides. I just wondered if we could have a couple of thoughts from you about the current trends in suicide and how we as a community, how we can navigate through COVID-19 together, what kind of things we should be thinking about.
I think there are several things we need to be thinking about. One concern is about the job losses and rises in debt that are associated with the public health measures put in place to help offset the impact of COVID-19, reduce the spread of it. So that's going to have knock-on effects on people's education, people's capacity to seek help, the sort of support that men will receive from one another. So I think many of the risk factors for suicide are likely to be exacerbated by physical distancing or social distancing, as it's called, as people have to spend more times in their homes. They're less able, men in particular, if you like, to go out to the sort of social venues where they can socialise, if you like, safely with other men, sports venues, pubs, clubs, and so on and so forth. I think a challenge that men face is seeking help and talking about their feelings. And I think it's likely to be more difficult in a time when there are less opportunities for them to make social contact.
Do you think there are some priorities that we should be looking at in Somerset, drawing on from your knowledge from your national perspective?
I think one of the key things to think about is identifying the hard to reach groups, the groups who aren't likely or are less likely to be seeking help from their GPs, the groups who perhaps aren't working for big companies where support might be in place if there are redundancies made or if people are experiencing economic difficulties. So perhaps people who have their own businesses and small businesses. So think about men are much worse than women about seeking help. And anyway, in the period leading up to suicide, around 40% of people in the month before their death by suicide don't seek help from their GP or any health services. And men are particularly bad at doing that. Raise awareness of what you have on offer to those who could act on their behalf. So they, whether it's a friend, a family member, could seek help with them and encourage them to seek help from that place.
Finally, why do you think it's so important to bring people together as we have done, we're doing in Somerset, to discuss this whole issue around suicide and suicide prevention?
It's really great that you're doing this. And I'm sure I don't need to say this to this particular group, but there is still a widespread misapprehension that suicide is not preventable. But there are very simple things that you can do to prevent suicide, particularly by sharing knowledge, sharing experiences, by groups working together who might be, previously perhaps been rather disconnected, working with organisations that might be in the front line in seeing people at high risk, for example, job centres, people working in debt agencies, and thinking how you can offer support to those staff who are in contact with high risk people. So I think it's great to draw upon the experiences of people from different professional backgrounds, different personal experiences, and kind of capitalise on that shared knowledge to see what one can do to help those who are seeking help, and perhaps those who are not coming forward to seek help.
Yeah, well, thank you so much, David. Thank you so much for sharing your thoughts with us today. It's really great. Thank you.